Welcome to T's Voices, telling the stories of the people in our NHS community.
Hello everyone and welcome back to another Allied Health Professional podcast with Alison Kerr and Jennifer Trafford.
We have got Alan Macdonald with us today, who is our Head of Allied Health Professionals across the group. Welcome to the podcast, Alan.
Hi, thank you very much for having me. It's lovely to be here. So my name is Alan. I'm the Group Chief AHP. I'm a physiotherapist by background and still a practicing physiotherapist. And I represent the 16 possible AHP groups that could be within the organisation, but we have representation of 12, we're really proud to say. So my role sits at group level. My boss is Emma Nunez, who's the chief nurse, and I meet monthly with the chief medical officer and also with the chair of the trust. And really my job is to make sure that from a corporate point of view, I am flying the flag for AHPs. I'm looking at the national priorities for AHPs, and I'm linking in to be working with the service managers and the team leads to be knowing what the real pressures are on the ground. So your voice and listening to you is a really key big part of my job, and I would really encourage people to book some time with me, to come and chat with me and to tell me what's going well and what's not going well. Part of my job is I'm out and about meeting teams and getting to know what's happening. Last week I was in the ODP services, so I do try and have a clinical session once a week, not necessarily with me treating patients, but with me coming to different teams to understand exactly what you're doing, what your pressures are, and what's working really well and what we can celebrate.
Thank you for bigging up the ODPs there. How long have you been in the role?
So I've been in this particular role for just over 6 months in the group role. Previous to that, I was at North Tees as the Associate Director of Allied Health Professions, and that was a new role that I was in for 12 months. And prior to that, I was the Head of Physiotherapy at Newcastle for 6 years. I've had multiple jobs within the Northeast. You'll hear that I'm Scottish. I came to university in Newcastle and then never left. I still live in Newcastle and travel to Teesside every day. But I think the Northeast really resonates with Scottish and Irish people, which is why we've got such a big representation, because our core values really are extremely similar and we're friendly. And that really comes across in our AHP family here because we just want the best for patient care.
Absolutely. So what are your kind of goals going forward for allied health professionals across the group model, especially now with that being new?
So allied health professions are the third largest workforce in the NHS. We represent 17% of the staff between North Tees and South Tees, with over 2,100 staff. And really, therefore, my goal is that we are listened to and heard appropriately because we're a really powerful network of staff. And particularly within the NHS long-term plan that was set out very recently, there is real opportunity, and the time for advancement of services led by AHP has never been better and stronger. And we really want to be able to escalate what we can do, the power of what we can do, the quality and safety that we can bring to the organisation, and the increased patient experience that we can offer by allowing patients to see the right healthcare professionals at the right time and avoid duplication.
I can hear the passion for the allied health professionals in your voice, and it's good to know that we've got that representation there. What advice would you give for allied health professionals out there now then?
So I think we're in a really fortunate position as AHPs. We're vocation trained. We come because we've got a passion and a mission for our patients. And although we have different contributing factors because of the pathways that we're trying to deliver and the care that we're trying to deliver, what's really nice about AHPs is that we work so well collaboratively and that we can communicate, we can ask questions, we can push the boundaries, and we can really showcase what can be done. I think my message to staff and the privilege, I think, of being an AHP is that every day is different, every day flies by. sometimes that can be really pressured in the NHS that we work in today, and we need to make sure that we're civil to one another and that we're kind to one another, and that we realise that different people have different pressures placed upon them in different services. It's not that one service is slightly easier than the other because it's better resourced or because the patient pathway looks slightly different. But I think what I would be really pushing and supporting with staff is that we have a culture that's kind and civil, that we have a culture that's inquisitive and really supports innovation. I hate when people talk about this band or a hierarchy. I think that we have great ideas that come from all levels of staff, and we need to listen to all levels of staff, because patient care delivered by a support worker, by a qualified member of staff, by an ACP is all as valuable as one another. And we've really got to start thinking in the NHS of how some of our scientific fellows and companies work, how NASA work, how some scientific organisations work, where we've got to think of the overall aim. The overall aim is discharge, getting patients well, or preventable healthcare. And we're all in that together, and everybody's point is valuable. It's not dependent on your band, it's not dependent on your pay. Everybody's part that they put into a patient's journey is extremely important. And actually, for the patient, sometimes the most important people they might meet might be the first person that they walk through the door to. It might be the person greeting them. And if that's not a positive experience, their entire journey isn't a positive experience. So we've really got to think of our place in that. And I think it's a real privilege to work in healthcare, to be someone who can shape the future of someone's life in that way.
I think from my point of view, because my role now is the human factors and civility educator, I find that because allied health professionals work very much within MDT teams, we are really good at actually thinking about other people's points of view and perspective, because we are generally invited into other teams, aren't we? And that makes us uniquely different to see things from other perspectives. And I think it's one of the rarities that we have as allied health professionals. So I agree with everything you said. And I think it's a really good message to put across.
I think it's a superpower that all HPs have. I think that's a real positive. I think sometimes it can be a burden, if I'm absolutely honest, because we're so proactive and we've tried in the past to create solutions, move services forwards, nudge and take little bits of extra work on without the recognition or without the funding to do so. That actually, sometime down the line, we're now seeing services who deliver not just A, B, and C, but they've got to kind of X, Y, and Z, who are bursting at the seams and who are asking now, what can we pull back on? What can we stop? How can we get additional resource? As we move into group at the moment, that's a really important message. And we've been doing a lot of work around job planning in order to understand exactly what people are doing. We're just about to start working on capacity and demand work to understand further exactly what safe staffing numbers look like in different areas and exactly what that means in translation to patient care. And it's really important that you guys are involved in that, because it's the staff's perception of that's the really key bit. People at my level can absolutely come up with forms that need to be filled in, with systems that we need to buy to support that. And I can feed the message forwards and back with some really great people to support that at different levels. But actually, the key messages come from the staff, and they come from what it means to be busy, to be burdened, to be pressured. And in an NHS at the moment where we're looking for more productivity with less money, we have to really think of innovative ways of working, and we have to listen to people on the ground with ideas. And that's where it's also really important that we have that collaboration with our patients, to make sure that we're making a service that's fit for the future that the patients actually want.
So how can the staff get involved in them discussions then? In what ways could they get in touch with you?
I think there's lots of ways. You can absolutely have discussions at your team meetings, and anything that's minuted or anything that comes forward for that can come to me. You can invite me to your team meetings. I'd love to come along to some team meetings. I have drop-in sessions once a month that people are welcome to come to. We've just started doing FAQs and all staff group meetings on a Friday, every second Friday, which is a half an hour Teams meeting. And I'd be really keen for staff to put forward topics that they want discussed, questions that they want answered, and they can send them directly to myself, and then we can look at exactly what can be. Often people might think it's a silly question, they might think it's a question that they don't want to put their name to or think about, but actually what I often find is when someone asks it, 10 other or 20 other people are thinking the exact same question. And when you put it on an FAQ, people are like, oh, thank goodness we haven't had that addressed. I can absolutely look at what my priorities are, but this job isn't a lone job, and it becomes a very lonely job if I try and do it as a lone job, with me sitting in a group team just below exec level, trying to really showcase the AHP voice in a group of nurses and managers, when actually what I need is that the power of all of you guys behind me to be saying these are the real life examples of what's happening out in the field, in the hospital, in the community settings. This is what this means to our patients. This is our examples of celebration. So things like AHP Day, we're going to have a conference. It's really key that we have representation of all professions there, because we're going to have some really key exec members of staff there. The CEO is going to be there, the Director of Transformation. We're going to have the chief nurse looking at the kind of awards that we're doing. And actually, it's really important that people make time to come to events, to shout about their services, to tell us what works really well and what their ideas are for the future, because we need that buy-in and sign up. And while I can do that to a point in that focus, I really need that to be heard loud and clear from lots of directions.
Can I just say, from a fellow allied health professional, thank you so much for representing us so strongly and for making yourself accessible. I think the culture of having somebody who is openly saying, I need to hear your voice and I need you to have my back while I'm having yours, is really powerful. And I just want to say, from everybody in the allied health professional world, massive thank you for the way that you're doing this. Any last thoughts while we wrap this podcast up?
I think my last thought probably would be, we're going through a real time of change at the moment. It's a difficult time. It's a difficult pressure in different ways for different people. And with that, one of my core values is vulnerability. And I think it's really important that people know what their 3 or 4 core values are. That they align in many ways with the trust in the organisation that you're working for. And I hope that when you look at the group values, that you can align with them and you can feel that that's what makes you get out of bed in the morning and makes you come to work, because you share those. But when I speak about vulnerability, what I mean there is it's okay to say to people, I'm really finding this difficult, or this is a challenge, or I've got some great ideas, but I don't know how to implement them. I don't know where to go to. Or let's run with this and let's see how we go. And if we don't get it right the first time, that's okay. We can change it, we can refine it, but we're going to end up with a better outcome. So I would challenge everybody, be vulnerable in work, support one another by kindness and civility, but actually let people know your ideas, your thoughts. Don't hold them in internally, because many of you will have absolute golden light bulb moments when you go through that process, that other people will be thinking of the same thing, maybe in a refined way or a different way, that actually comes out with some genius ideas of how we take patient care forwards.
Brilliant. Well, it's been fantastic, really refreshing to hear. Really good that we've got the support, and we'll have your back too, Alan. I'd just like to say, take care of yourselves
And each other.
Thank you.
Thank you very much.
Thank you for joining us. Till next time, you've been listening to T's Voices.